The thing I think about is the time, and I'm curious what your expert opinion is on this, but sometimes I'll tell parents it's better if we take care of the suture, in my office rather than waiting for the time to see a plastic surgeon. Do you find that the time till closure matters?
Okay, that's a hard one to answer, but I'm going to answer you. You want to get things closed as soon as possible if you can. Having said that, I've been called at 8, 9, 10 o'clock in the night and we do it the next morning and it's fine. I'm just being honest with you. You can put a Band-Aid on it if a kid gets cut or hurt at 7 o'clock in the evening.
Okay.
And you wash it with peroxide and put a Band-Aid on it, and I do it the next day. Let's say I'm out of town, I do it the next day. It's going to heal fine, I'm telling you, because I'm going to clean it with betadine very nicely, and I'm going to close it. Now, if you're near the ER and you want to get it done that night, go for it and do it. But I have done things the next morning, like even if it happened at 10 or 11 or 12, we let the child sleep, meet me in the office in the morning, things heal fine. You don't want to wait 2 days, but if you waited till the next morning, it's not the worst thing to do. If you're close to an ER and want to just get it done, then just get it done.